Lacey Everett here with Minds in Motion. Today's guest is Dr. Sternlicht. Dr. Sternlicht has his bachelor's, master's, and Ph.D. all in the physiological sciences, health sciences, and he got them all from UCLA and actually taught at UCLA for about 10 years and then moved to teaching at Occidental College and now Chapman University, all in the physiological sciences. Dr. Sternlicht was a bodybuilder and a cyclist, both at the national winning professional level. He also has his own nutrition consulting company called Simply Fit. Dr. Sternlicht was also a nutrition and exercise coach for top-level Olympic athletes and actors such as Clint Eastwood. I really could not think of anyone better to talk about how diet and exercise plays a role on the body and the mind. Dr. Sternlicht is going to give us diet and exercise tips, how to recover from injuries faster. He's also going to talk about osteoporosis and what causes it and how to prevent sarcopenia and what causes sarcopenia, how exercise prevents stress, resistance training, cardiovascular training, and flexibility training. He's really got it all, and I trust his word. So here we go, Dr. Sternlicht. Hi, Dr. Sternlicht.
Hey, Lacey, how you doing?
Hi, it is so nice to see you. I wanted to ask you what the roles are with diet and exercise on the body and the mind.
Well, thank you very much. I talk about wellness being a combination of, well, health is like just a low level of well-being, whereas wellness is the optimal level. So rather than just trying to be healthy, you're trying to be optimal. And there are different realms of health and wellness. So, not only is there physical and mental, but there's psychological and spiritual, financial. So there are all these different realms that make up health and wellness, or unhealthy behaviors as well. With the athletes or the actors that I worked with, and as I tell my students, you don't want to just work for that average, just at a minimal level so that you stay healthy. You want to be, have that goal to work and perform optimally. So, with that said, there is nutrition and research on nutrients and foods for an optimal psychological and neurological health and wellness. We know that omega-3 fatty acids are anti-inflammatory, both physically as well as neurologically. So psychologically, they play a role with your brain's health, which is very important. A whole food plant-based diet is generally what I recommend to my clients for their overall health. It depends upon the athlete that I'm working with, but or the actor. Usually with the actor, it's for appearance sake. They're getting ready for their movie or TV role, or they have to look a certain way. And then you modify their diet slightly, but following a whole food plant-based diet most of the time, it really improves one's health. And by whole foods, it means minimally processed foods.
Mm-hmm.
And this is a diet that's used for disease, not only for treatment, but for regression of different diseases such as cardiovascular disease, some neurological disorders, cancer, certain forms of cancer, diabetes, osteoporosis, and other diseases as well. So
Wow.
It feels good that I'm not just putting athletes or actors on a diet that's good for their appearance or an athlete's performance, but also it's going to benefit them for their overall health throughout their lifspan.
You know what? That's really nice to hear, because we see all these advertisements, lose weight in 3 hours, or, all these little things that get people's attention, but it's really not the healthy way. And when you describe, okay, it's benefiting their overall health to prevent disease, but also getting them the goals that they want, that sounds like the absolute way to go.
You have to remember that food manufacturers are in the business to make money. Restaurants are in the business to make money. So in my science of obesity class, I talk about, how the restaurants change the lighting and the position of tables relative to the TV or a bar, so that people order less healthy foods, which may be a lot cheaper to make, order more desserts when they're put in the back of a restaurant than those at the front, looking at the plate color. So there's a lot of behavioral choices that we're making subconsciously with our eating patterns. And it's important to educate people about that as well. But the businesses are in the business basically to sell food and make money. Mm-hmm. And they're not regulated very tightly by the Federal Trade Commission, which regulates the advertising of products. And the FDA is very loose in their regulations and following up.
I'm glad that you're educating us on this, because it's stuck down there in our unconscious, and we don't really think about these things. But now that we got to hear from you talk about it, hopefully people will be able to notice it. And you mentioned that you recommend, kind of in general, a plant-based diet. I'm curious why.
Well, most of the studies that have been done since the 1950s, but in particular during the 70s, with Nathan Pritikin and the Pritikin Foundation funding Dr. Bernard, who was my mentor at UCLA, all the way through Caldwell Esselstyn at the Cleveland Clinic, or Colin Campbell, who has his book, The China Study, and they have diet books, or I don't know whether you should call them diet, because the real word for diet is really what you're eating. It's not diet with calorie restriction. Like, calorie restriction is one type of food intake, but diet is the foods that you're eating. So, there are diet books. For Caldwell Esselstyn's book, The Prevent and Reverse Heart Disease, his son is an MD as well. Colin Campbell's son is an MD. Caldwell Esselstyn's is a firefighter, and he has a book out too. So there are numerous resources on a whole food plant-based diet that are available right now. Michael Greger has a website, nutritionfacts.org, that has 5-minute videos. They're free on all different nutrition topics, exercise topics. And he's an MD, and you can look through all the videos. And in his videos, he actually goes over particular medical studies that have been done on the nutrients or on exercise and longevity or mortality and morbidity. So they're excellent resources for somebody who's interested in that topic, and which should be the general population.
Mm-hmm. It's so interesting how much diet plays a role in our psychological self as well as our physical self. And I'm curious how exercise plays a role.
I just thought of one thing to add to the nutrition or diet area.
Oh, okay. Say it.
Yeah. And I say this in my classes. Every nutrient that you take in, and your choice is what nutrients you do take in, become parts of your cells. So when I mention omega-3 fatty acids, which you get in fish oil, or you can get from flax and walnuts and other plant-based products. Those become our cell membranes. And our cell membranes, when they're exposed to some type of stress, become what are called eicosanoids, or local hormones. And that's where they have either anti-inflammatory or pro-inflammatory choices. So, you think about the protein, carbohydrates, and lipid that are in foods, and you see them on the food label, but you don't really think about those chemicals that make up that food become your cells and determine how your body functions. So it's critical for an athlete who wants to be working at the optimal level and perform optimally to take in the proper nutrients before, during, after exercise, so that they are able to perform optimally and also recover optimally. Because during your recovery period is when you actually adapt from exercise. It's not during the exercise. The training that an athlete does is only creating the stimulus for adaptations, for them to improve their fitness, their speed, their agility, their power, their endurance. They're not improving during their training unless they're doing skill aspects of their training. When they're doing conditioning and fitness aspects of their training, they're breaking down nutrients. Sometimes they're breaking down the muscle or connective tissue, doing microtrauma. And it's during recovery where adaptations take place, where you improve in terms of your fitness. And that's why rest is optimal. You need to make sure that you're resting and sleeping and taking care of yourself psychologically so that you don't have the stresses that come with everyday life. You have some tools with which to cope with your stress. You may see a therapist or a sports psychologist to work on those aspects. And then you take in the optimal nutrients for that adaptation and improvements to take place. So then with training, it really depends upon the type of athlete you're working with. Because, I generally, when I was working with the Olympians or with the professional athletes or even high school athletes and collegiate, it really depended on the athletes' coaches, their skill coaches, to work on the sport themselves, except for cycling. When I worked with cyclists, because I was a competitive cyclist myself, or in bodybuilding when I was a bodybuilder and worked with those athletes. But I was generally their nutrition consultant and also their exercise, just general fitness, conditioning consultant. Or I actually trained some athletes as well. The cyclists, I would ride with them and have them on a training program to optimize their performance in a competition, in a race, an event, or in the off season to build up their base conditioning. But it depended upon whether an athlete was a sprinter, like Dotsie, who you'll be speaking with, who was an Olympian track cyclist. It's quite different for an athlete like her, who's doing 4 minutes of effort, and some other athlete, like Steve Hague, for example, who is doing an hour effort and in a time trial, or doing a 4 or 5 hour effort. That's in long-term endurance on a bicycle, or a triathlete that I've worked with who may have a 7-8 hour event. If they're doing an Ironman triathlon and it's 8+ hours, they may have a shorter event if it's a half Ironman or something like that, or Olympic level. You're talking an hour plus. So it's quite different, and the nutrients that they need to take in during the event and immediately after to recover is critical.
Nice. So it really depends on what the athlete's sport is and what you were saying, to go back on the nutrition aspect. So that famous saying, I mean, you just proved it to be true. You are what you eat. And the fact that the omega-3s become part of your cell membrane, and what you're eating really is becoming a part of you.
Yes. I worked with a collegiate, high school and collegiate ice hockey player, and they're on the ice for a very brief period of time, and then they go back to the side and sit down, and they call them waves, and they're only on for sometimes 20 seconds on the ice, and then the wave comes off, and so it's very explosive for them. And taking nutrients in the proper way so that they don't have peaks and valleys, so the blood sugar stays more stable. It's critical that before exercise, they actually don't eat during the last 45 minutes before exercise, and then begin to take in nutrients while they're warming up. And they'll be exercising at a much higher level or intensity than will an endurance athlete who's going to run a marathon.
How interesting. And Dr. Sternlicht, on a simple level, could you explain how exercise is beneficial for people in general who maybe aren't top Olympic athletes or professional or high school athletes? Just kind of.
Sure. Two ailments in our society are osteoporosis, which is the weakening and leaching out of minerals from our bones. It starts at most people reach peak bone mass around 25. Females begin to lose their bone density after that. They'll lose it slowly till they go through menopause. So postmenopausal women have a much higher incidence of osteoporosis than do males. Males maintain that peak bone density till senescence and then start to lose bone, but at a slower rate because they have testosterone at much higher levels, which stimulates the bone building cells of the body. There's also a process that takes place from about early adulthood. It's called sarcopenia. It's the loss of muscle fibers. So what they originally they noticed that there were more type 1 slow twitch muscle fibers in older individuals. What actually happens is there's a preferential losing or loss of type 2 or fast twitch muscle fibers, because they're what's used for strength, for power, for ballistic movements. And if you never do them, if you're sedentary, then you undergo this sarcopenia. And that's why the American College of Sports Medicine and even the AMA now recommends resistive exercise along with cardiovascular exercise, so that you don't have that muscle and bone loss.
So pretty much we need to exercise so this doesn't happen to us. And it's important because when we are doing resistance training, like you said, cardiovascular training, flexibility training, and resistance training, the three tokens that we have to help us to better improve our physical health, so then we don't end up with well-being, so we don't end up with osteoporosis or sarcopenia and such.
Yeah, I mean, the goal in life is to function optimally throughout one's life and through old age, and then have a rapid decline where unfortunately everyone has to die. The problem is most people start to decrease very early, and then their function goes down. And unfortunately, with a limited functional capacity, they can't do the activities of daily living, and then they're dependent on a caregiver or the family. And that's why people go into assisted living homes when they're older, or they move in with family members. But even doing that with the family members, you want to be able to be functional. Older people, back in the 1950s or earlier, usually, cooked for the family, did, ironing and daily activities. Now, older individuals who are sedentary their whole lives and eat a Western diet typically are diseased. They've developed what are called chronic disease, lifestyle diseases, which develop over a lifetime. And that's why cardiovascular disease is the number one killer at this point in time. And cancer is the number two, with smoking accounting for more than all other forms of cancer combined. And we know that smoking is a lifestyle decision for most individuals. Lung cancer is 95% of lung cancers are as a result of smoking. And that's why there was such a big push for that in the late 1900s to eliminate that. Now, unfortunately, in the current times, COVID is going to become, one of the leading killers in 2020, and maybe, hopefully not in 2021. Mm-hmm. But up until that point, if you go to the CDC website, you'll see, which keeps statistics on mortality and morbidity, you'll see that heart disease and cardiovascular disease was the number one killer, with the myocardial infarction being the number one, and stroke being number four, and cancer was number two. Right now, COVID is outpacing them, unfortunately.
Mm-hmm. Yes, it is unfortunate. And so what I'm hearing you're saying is that in order to prevent these things, myocardial infarctions and cardiovascular disease and osteoporosis and such, is diet and exercise. Okay, so Dr. Sternlicht, I wanted to ask you one more question. How do you get through injuries? Because you've been through it.
It can be tough. One thing that's helped me throughout the years has been therapy, and seeing a therapist. Some of the athletes have actually gone to sports psychologists and worked with them. The Olympic team has sports psychologists to work with, and it's important. And I think it's important in consulting the athletes that I work with, and it was for myself, to work on their mental side of performance. I always, within myself, I wanted to enjoy the race. You probably remember me saying to the class, enjoy the exam.
Yes.
If you're doing something and it's your choice to be doing that, you ought to be enjoying it. And if you relax, parasympathetic nervous system overdrives your sympathetic nervous system, then you'll have better recall or better performance. So, it's important not only in performance, but in recovery, to deal with not being able to do their outlet, whatever their outlet is in their sport, and making sure that they deal with the psychological aspects of that along with the physical aspects. And seeing a sports physician or a sports physical therapist, so that their degree of training the athletes is understood. I recently had a cardiac arrest, because of AFib, and my heart stopped beating. And after going to physical therapy for about 6 weeks, now I was in a coma for a period of time and then in the hospital, an inpatient rehab center. But when I was released from the hospital, after about 6 to 8 weeks, I was doing 1 minute more of riding a day on a stationary bike, or 1 minute more of walking. And I was up to 30 minutes and I wanted to do more. And the physical therapist said, talk to your cardiologist. So when I was in my cardiologist's office for an appointment, for a checkup, I asked him, the physical therapist wants me to ask you, how hard, what intensity should I be exercising at, and what duration? And he goes, I really can't tell you that, because for you were on your bicycle for 3.5 hours before you went into AFib and then had cardiac arrest. So it has no bearing in terms of your overall health and condition for me to say exercise for 15 minutes or 30 minutes when you go out and you exercise for 4, 5, 6 hours. And when you were racing, you normally would race, if it was a road race, for 3, 4 hours at a time with no problem. For my 40th birthday, I did a 200-mile ride. And, that was relatively easy because I was highly conditioned for it.
Wow.
So, I wouldn't be able to do that again, but the cardiologist understood that, the amount of exercise that I can do can't be withstood by most individuals because they don't have that base or history. So with an athlete, it's important for the clinician to understand that too. He said, I just don't want you exercising to at this point for the duration that you become tired, so that you're fatigued and you can't heal. And
I see.
In terms of intensity, at that point, he said, I was limited at the physical therapy center to 100 beats per minute. And he goes, I can't really tell you intensity, but at this point, I don't want you exercising above 150 beats per minute. And that's much higher intensity. Whereas I'd be at 45 watts on a stationary bike, which was nothing for me. I used to race at 400 watts. So 45 watts, I had no tension on the meter, and would just basically move my legs around. Where 45 watts for some individuals, that's a pretty high intensity. But I had to keep my heart rate below 100 beats per minute. Just moving your legs or moving some limbs will increase your heart rate. So I could barely do anything in terms of what I would perceive as exercise.
Yes.
I was doing physical activity, so it was very low level. Even after coming out of a hospital and recovering, when I was in rehab, at that point I was conditioned to be able to, do much more. But you still need to mind the therapist, because athletes generally tend to go harder than they should. One of the saying that I have in my exercise physiology class, and I've said to some of my athletes, is that athletes tend to go harder on the days that they should be going easy, and not hard enough on their high intensity days. So they get in this comfort level, and on an active recovery day, it's really what that says, recovery, at a very low heart rate, but just, flushing the muscle and doing, some activity. Whereas a high intensity day, any athlete that's done intervals know that, you can't be comfortable doing intervals. You can't be comfortable doing rep max sets. there is some pain involved, and that gets back to the psychology of it and desiring that type of activity. But if you're recovering from an injury, you need to then heed the warnings of somebody who understands what intensity you need to be training at for the tendon to heal, for the ligaments to heal, for a fracture to heal, because oftentimes you'll end up doing far too much too early, and then you don't recover, you get compensation injuries, and it just leads to overall poor performances.
Okay, so everyone listen to your doctors.
If you feel differently, go to see a second clinician for their expert opinion. You know,
Yes.
don't, you know, a saying that they have is, you know, the doctor that finishes first or the doctor who finishes 250th in their class is still called a doctor. You know, you know, have an advocate there with you. You know, don't be afraid to ask questions. It's your body.
Mm-hmm.
You know, whether it's injured or diseased, it's your body. So you're responsible.
Yes, it's your body. And that's really good advice to kind of seek out different professionals, healthcare professionals, and kind of just think, you know what, this is me, this is my body. It's important to me. I'm the one living in it. So
I mean, I've had numerous AC injuries and muscle ruptures and tendon ruptures in my shoulders. And I've had 3 orthopedic surgeons, two that ride on, they don't race, but they ride on a club that I used to be a member of. And both of them said, don't operate. Don't have an operation. When do you ever lift? You know, I had a full thickness tear of my supraspinatus muscle, which is one of the rotator cuffs, and I had an AC joint dislocation, but it was a 3rd degree, so it you know, it was more cosmetic than it was you know, painful. And they said, you know, let it heal. You know, it's not your dominant hand, and you don't do manual labor. So, you know, when do you have to lift something up above your head that weighs something? You know, you don't.
good point.
So
Mm-hmm.
I wouldn't have surgery. And I've known athletes who have had multiple surgeries, and for a former sheriff, that's a good friend of mine, who had 4 shoulder operations on the same shoulder. And, you know, he's relatively young, but, you know, his shoulder will never be the same once it's operated on. And, you know, he was put on desk duty when he had the injury, and he was actually retired early because of his limitations due to the surgery.
So it's so important. Oh my gosh, I can't stress that enough after hearing this. Seek out all of the advice, you know, all of the medical professionals, and surgery might not always be the right thing for me, and, you know, kind of going about all of your options. Another thing that stuck out to me from what you said was athletes tending to go harder than they should because they're used to that. And we train our minds to think we're capable of a lot, which is great. But when you're, you know, in recovery or when you're injured, it's not so great.
Yeah, one other story to say is a good friend of mine who is on my cycling team. He had a full thickness tear of his supraspinatus muscle. He was an orthopedic surgeon of his knee. He did not have surgery. And when I needed a spinal fusion, he recommended that, well, he didn't. I had gotten a referral from my primary care physician to see a back orthopedist who was lacking in bedside manner. Let's put it that way. But he was one of the best in the nation as a surgeon. And I asked my friend, I saw him and he asked me who was going to be doing my surgery. And I mentioned his name and he goes, "Oh, I refer all my patients who need back surgery to them or to him." And even when my patients come back and said, well, they had a meeting with him and there's no way I'm going to let him operate on my back. And he says to them, he's an orthopedic surgeon as well, "Do you want the best surgeon in California, or do you want your best friend operating on you?" So when you're going in for surgery, bedside manner isn't that critical. You know, you need somebody who is highly knowledgeable and highly trained and also highly skilled. And, you know, in terms of my rehab from spinal fusion, within 2 months, I was released from physical therapy because I was already at the point where I was able to do all my activities and I was able at that point to go back to cycling. So, then that was, the surgery was due to a crash that I had on a bicycle. So, you know, that's a story where, you know, it's not so important to have the you know, best doctor in terms of personality or bedside manner, but in terms of skill, that's what's really critical.
I feel like even for myself, a lot of people, you know, go into the room, meet the doctor, shake their hand, and personable, and they're nice. They make you feel comfortable. It's so great. It's like, oh, I want them to work on me. But really, I mean, it's like you said, if they have the skills and they know what they're doing, that's what matters.
Undergraduate education, physicians need to take sociology and psychology so that they have some improved bedside manner. But up until, you know, recently, that wasn't required for doctors. And, you know, of course, you know, everybody has a different personality.
Yeah.
And you can like him or, you know, just think he's okay personality wise, but you want to find out expertise wise when you're looking for a surgeon.
Yeah, absolutely. That's great advice. And okay, I want to talk to you forever. I could talk to you forever, Dr. Sternlicht, but we've got to get going. And I know you have to get going, but thank you so much. Gosh, you've been through a lot. You've been through a lot. And we didn't even get, I mean, we didn't even get into all of that. That could be like a book. It has shaped you into this wonderful person and is going to help a lot of other people learn about, you know, how to eat healthy, exercise, what are the consequences if you don't, and how to go through injuries, looking for the right people, you know, looking for the right doctors and the right advice, and just being knowledgeable of that. Thank you so much, Dr. Sternlicht.
You're very welcome, Lacey. Thank you for this opportunity.
Take care.
Bye-bye.